topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, San Antonio. Welcome to another Ask the Expert show, where for the last 16 years we have brought you the top experts in the field of legal, health, financial, and home improvement. Hey, this is towards the end of September. Next month is October. And I got to tell you, if you're at that age for Medicare, you do not want to miss this morning's show. And I'm telling you, because I was one of the not so informed people about Medicare when it was my time, and it cost me dearly. I wish there would have been a show like this available to me back then, not too far back then, but we found one of the top agents in the San Antonio area. I love this name, Medicare Gals, the signature team. Let me introduce you. This is her second show now, and to me, this is just a special show because I went through not understanding Medicare. Good morning, Susan Shimp.
Good morning. Thanks for having me.
Oh, I was just complimenting her. She's an hour. We're in the East Coast, and Susan is in the Central Time Zone, and she was so vibrant. And she just told me she had to take her daughter to school. So first of all, we know she's a great mom. But Susan, what a great name, Medicare Gals. Tell me about your company.
So Medicare Gals, we started in 2015. And it's just a local Medicare resource center. It's a bunch of women, and we are just here to basically help navigate you through the confusing maze of Medicare. There's so many resources that are left unattended, and we want to make sure that we address Medicare just because it is complicated.
Yeah, yeah. Trust me, I know. But I want to tell people, because once in a while online you hear about people with negative comments about Medicare. I'm going to tell you something. I love Medicare. I think it's the greatest. We've paid a long time.
Sure.
And I think that people deserve Medicare. So we're going to probably get rid of some of those myths that Medicare is not good.
It's bad.
So, Susan, I told you, we started promoting your show a couple days out, and it's amazing how many letters we got from people going, please ask your guests, what's the difference between Medicare and Medicaid? I can't tell you how many of those letters that we got.
Yes. It's so confusing. I wish they would change the names because they are too similar, right? But Medicare is what the federal government gives you at the age of 65. It's the insurance that you get automatically. Once you turn 65, it's given to you after being paid into so many years. Medicaid is state funded, and it is based on income. So the lower income, then you can apply for Medicaid, like through the state of Texas. So Medicare is federal, Medicaid is state. And so Medicaid is only based on income.
You make it so simple. I'm going to say this, and we try not to commercialize our shows very much, but I think this is so important, Susan. My first agent was horrible, and I didn't realize that he was horrible until after my first year. And I
Yeah.
started hearing about what others get with their Medicare, and I just call him an order taker. He
Yeah.
would just contact me at the end of the year, and even then, sometimes he didn't even do that. He just wrote it up without even discussing it with me,
Oh,
and
that's
it
not
does
good.
change. So I learned that an agent is so important. Um, go through an agent, and Susan, you represent multiple companies, right?
That's correct. So I'm a broker. I'm contracted with multiple insurance carriers because one size does not fit all. So one carrier could be good for the next could be good for your spouse or your neighbor. It's all based on prescriptions. It's all based on your doctors, your financial needs that you have. So it's really, we cater it to you specifically because there's probably 55 different plans in the state of Texas. So there's a lot to
Wow.
choose from. And you're like, which one do I go for? So that's where we help guide you and figure out the best option for you. And I'm your fiduciary. So I'm working for you, not for the insurance companies, because, they're all pretty much, they
Right.
run the same way. They give pretty much similar benefits. It's just what's best for you.
And from what I understand now from doing these shows, it's actually broken down by your zip code, right?
Zip code and county, yes.
Yes. So you could be talking to somebody in another county and comparing notes when it's different, right?
And that plan may not even be in that county. So,
Oh,
it's a lot of, it's all, Medicare says you can't have all the plans in every single county. So they basically have to pick and choose where they want to put their plans, the insurance carriers.
well, some of these letters that we got for your show this morning takes me right into my first question, and it's one that a lot of people have now. Annual enrollment period. Tell
Yes.
people why that is so important.
So the annual enrollment period is something that happens every single year. So 2026 plans get released to the public October 1st. So October 1st is when you get to see all the new plans coming out for next year. You probably have already received your annual notice of change. That usually comes late September, but that tells you also what is coming for 2026. But you can go online. We as agents can also see what's coming out, and we can start running medications. We can start running all the plans to make sure going forward for 2026 is the best plan. But annual enrollment gives you a chance to review your plan. So what you have this year for your plan may not be the best option next year because plans cut benefits, plans increase copays, plans terminate and exit from counties. And you think you have the best plan, and then you move forward to 2026. And if you don't review, you could be caught with higher costs with medications. You could lose some benefits. And then sometimes your plan doesn't even exist January 1st.
And this is going to start next month, right?
October 1st, we're a week away.
Have you looked at 2026 yet?
So we do have some sneak peeks that we get to look at, before the public, because we have to know what's coming so that we can,
Right.
educate our clients. There's changes. Let me just tell you that. There's some.
Anything big, Susan?
I can't really discuss until October 1st because legally we are not allowed to, but if you're in the Austin area, you might want to contact me because there's some interesting changes coming on there. The Waco area, that's got some major changes coming. San Antonio's pretty okay. The benefits are pretty okay. It's just the Austin and the Waco area that may need some help with their changes for next year.
So I think it's really important that people understand that they might be happy with their current plan,
That's right.
but they still need to review for 2026, correct?
That's correct, because prescription costs are changing. So what might be inexpensive this year could cost more, or that medication may not be on the drug formulary for next year. And then you go to the pharmacy and then you're like, it's not covered. What do you mean? It was covered last year.
Right.
So you just want to make sure that everything fits, everything is seamless, that you're not disruptive for 2026. So yes, please review.
Also a lot of the letters that we got, and every one of the letters we send them your phone number and your contact information. But a lot of them have seen these ads on TV, and I got to tell you, I think some of them they're scams. To be honest with you,
100%.
I mean the things they promise, Susan.
Yeah, they promise, oh, you can get grocery card, you can get
Yes.
all this stuff, right? Well, there's a catch to that. Yes, there are some plans that may give a grocery card. However, if you're low income, on Medicaid, like we talked about in the beginning of the segment, if you're on Medicaid, then yes, you can get a food card. If you have certain chronic conditions like diabetes, congestive heart failure, or cardiovascular disease, you can get a food card, but only certain plans. Not every plan has that. So if you do have a chronic condition or you are low income, there's certain plans that allow you to get these benefits. But again, it doesn't fit everybody. So it may not be beneficial for you.
I tell you, speaking of scams, my phone is ringing off the hook.
Yes.
With these robots, and I want to tell people, don't buy into any of those. It's so important to get a great agent like Susan. Susan, I think this year I'm getting more phone calls, these
Yes.
robocalls, than ever before.
Yes. So, yes, I'm not a 1-800 call center. These 1-800 call centers basically get sold your information. So when they get sold your information, they're calling you and all they care about is their quotas. What are they going to sell for the day? They don't care about you. They don't live in the area. They are just trying to make money. They're not here for you. So I always say, trust a local agent. If it's not me, just find a local agent, because they're the ones that are going to know your doctors in the network. They're going to know the pharmacies. They're going to know all the plans. These people in, different states and stuff have no idea what's here in the San Antonio or Texas area.
I'm going to leave myself out of this, but what are some of the most common mistakes people make when it comes to Medicare enrollment?
The number one mistake is that they don't review their plan. So they just let it roll over because they think it's just fine for them this year. It's going to be the same next year. So that's the number one thing that mistakes that people make is they don't review. So again, we review at no cost to you just to make sure you're on the right plan. If you're on the right plan, we tell you, perfect, stay where you are. But if there's some major changes, you do want to make sure that you get all your benefits that you need for next year. There's some cuts coming down the hatch with some carriers, less than what you have this year. So therefore, you do want to make sure that you do review. But that's the big mistake is the review.
And it's okay if you've had a plan that you were happy with to contact you, Susan, because there might even be better plans out there.
100%. Yes. So a lot of people are just loyal to one insurance carrier, and they don't know that another insurance carrier could be better because give them more benefits, but still cover your doctors and still cover your medications at low cost. So there's really should not be any loyalty to one insurance carrier because they all kind of run the same. It's just what's going to be better for you in the long run.
And some of them, because we're dealing with a older audience, some of them think they're going to be penalized if they leave the company they're with, and that's not true.
That's not true at all. These insurance companies know every single year. This is why they do the annual enrollment, which is technically October 15th through December 7th, but October 1st is when they get released. But these insurance companies know this time of year, people flip-flop back and forth. So they're always trying to win a customer. But, there's no penalty for, switching plans. It's allowed, and they actually encourage it because, we want to make sure that you're getting the better benefit. And also you can go back to that insurance carrier back and forth, back and forth. So there's no penalty. Just do what's best for you.
I just want to emphasize one more time, it is so important that you get an agent like Susan and let them, it doesn't cost you anything. Let them handle it for you. It's because there are so many companies out there. And I got lucky because after my first agent, I learned a lot. And it was costly because it cost me some penalties. And I missed a whole year because of it. This is so important. Again, next month is the enrollment, right?
Yeah, October 1st. Yep.
And is there a window, Susan?
So technically, we can start talking about 2026, October 1st. Enrollments into new plans for 2026, October 15th through December 7th. That's every year. That is the time of year that you're going to get phone calls. You're going to get mailings. You're going to see TV ads. You're just going to get bombarded because all the insurance companies are trying to entice you to come to their plan, right? But what's on that postcard that you get in the mail may not be the best option, right? So that's why call us and we can help navigate you through the different plans. And if you say, hey, I got this postcard from XYZ Insurance, can you check it for me? We can do that. So just make sure that you're on the best plan.
Yeah. The old saying, if it sounds too good to be true, it probably is.
It can be, yes.
That's so important. I don't know how much you can discuss about prescription drug costs. I mean, we keep hearing that the president's going to get them lowered. What should listeners know about reviewing their drug coverage?
So the Inflation Reduction Act started 2025, January 1st of 2025. That's where prescription costs got reduced to $2,000 from $8,000 in 2024. But it's going up to $2,100 for 2026. So, I mean, it only went up $100. But
better than 8,000.
It's better than 8,000, that's for sure. And also in 2026 is when there's 10 medications, like the most prescribed medications like Eliquis, Xarelto for like AFib, Jardiance, Trulicity, Ozempic, those for like diabetics, the retail cost is being negotiated down significantly. So the cost to the consumer as well as the cost to the insurance company is going to be a lot less. So we should see a big difference in those high cost medications for 2026. But just know that you're still got a lower cost when it comes to the complete out of pocket for your prescription drugs.
How can people make sure their doctors and hospitals are still covered under the Medicare Advantage plan?
So I would tell you, you can call the doctor's office, but I'll tell you not to, because these front desk office people at the doctor's office, most of the time they have no clue. So they're like, no, we don't take it. And then they come to me. I'm like, yes, you do take it. So best option is, if you want to find out, talk to a local agent. We can review it and tell you, yes, they're a network. No, they're not. We need to help you find another doctor, because the people at the front desk, there's so much turnover with them that it's hard to educate the front staff of all the insurances that they take. So I recommend just calling us or calling a local agent and finding out for yourself.
I got to tell you, here's one thing that happened to me is I'm on a HMO.
Yes.
And I love it. There's a lot of people who want to be able to choose their own doctors. I had no problem with the doctors in the group. But Susan, I saw that my doctor, my orthopedic surgeon, was in the group, and that's one I went with.
Yes.
And come to find out that my main doctor is in a separate group. I don't know if you've ever heard of this before. And they would not let me go to that doctor, but it showed that he was part of the group. Have you ever heard of anything like that?
Yes. And you're in Florida. So Florida runs similar to Texas. There's pod systems in Texas as well as in Florida. So certain medical groups cannot refer to other medical groups.
Yes.
It's like oil and water, right? So that's where us as agents can tell you, yes, you can go see that doctor because they're affiliated. But San Antonio, Texas, the whole state, Florida, very much run the same way with clinics. They're very much pod systems. So you got to make sure that the doctors don't refer to each other.
Again, we want you to get an agent like Susan. Susan, tell people how they can reach you.
So you can reach me. You can call or text us at 210-767-9876. Or you can go online to medicaregals-st.com. Susan
will be with us next month. We'll be in the middle of it all next month.
We will be in the midst of it, and I will be going crazy.
And hey, listen, if you missed some of the show, you can go back to iHeart, Medicare San Antonio under Ask the Experts. That's going to do it for us, Susan. Thank you so much. I can't wait to get together with you next month, and we'll really be into it.
We'll know what the plans are doing. Yes.
Yes. Thank you, Susan.
Thanks. Have a good day.
We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.